Hello everyone, and very good evening to all of you. First of all, a slight sorry for being a bit late. It was slightly due to the connection problem, but I think everything is okay right now, and we are fine to go. If my voice and everything is okay, please let me know so that I can start with a basic discussion that we want to have today. It's a very interesting discussion, I like to say, and that would be on convalescent plasma therapy for COVID-19. So this is a very interesting topic and upcoming topic also. So, this topic is so upcoming because I was getting so many requests to talk about, uh, the things have been so much overblown right now for COVID-19 that anything and everything that we actually get to know from various people, we would like to work or we would like to start or we would like to experiment on the patients. But when you go to scientific point of view, how much things are effective, how much things are required, and how much things are beneficial for the patient, that should be very much clear in our mind. So here I am discussing a small topic, interesting topic, I'll say, and the interesting topic would be convalescent plasma therapy for COVID-19. So number one fact, let's start with the basic things. What exactly is convalescent plasma therapy? So what all you know, I'm very sure that you might be all knowing that it is all about donating an antibody. And if you look at the antibody, talk about the immunity. So what exactly is immunity? Immunity can be an active immunity or a passive immunity. So when you talk about active immunity, in the active immunity, we all understand, sorry, in active immunity, so in the active type of immunity, there is this type of immunity in which we deal with that in our own body defense mechanism. That means when an infection comes and our body tries to fight with it, that is what is called as active immunity. But a passive immunity is of various types again, and one of the few examples that we should all know here is number one, a mother giving the antibody to the baby via the uterus, and second, there are some artificial means in which we inject antibodies, for example, immunization. So when we inject those from immunization point of view, that is called as passive immunity. Now, what exactly do we mean when we talk about this convalescent plasma therapy? So what comes to our mind? So what comes to our usual mind is we try to donate antibody in a plasma to a patient who is suffering from COVID-19 infection. So if you look at this, virus structure, there are very interesting things that you should all be knowing about. I'll just talk about them again. Therefore, what happens is, look, in this virus, these are the main things you should understand. And these are the spike proteins. Okay, they're called as spike protein. The spike proteins also called as the S proteins. So what happens, look, in our body, the lungs, okay, in the lungs, there is alveoli, and in the alveoli, there is type 1 and type 2 pneumocytes. Now, it is believed that on the type 2 pneumocytes, there are some receptors called as S receptor proteins, and those are called as ACE2 receptors. Okay. Now, this angiotensin convertase 2 receptors are the receptors on which the COVID-19 virus binds on it. So, when this COVID-19 virus binds on it, it actually starts proliferating inside this ACE2 receptors, and finally, this virus, as you all know, virus, what does it do? The virus uses its own RNA and uses the machinery of the host to keep on replicating inside the host. So the virus uses its own RNA. As you know, this virus has a single-strand RNA. As you see also here, it's a single-strand RNA. And along with the single-strand RNA, it will use the host machinery, that is a ribosomal complex, to make the protein. And then this RNA and the protein will again combine and to make more and more viruses. So now basically what happens is, this virus will enter a patient's body via the ACE2 receptors. Okay. So there was a thought process of why not to make an antibody in a patient who doesn't have an antibody right now. He may be infected in due course of time. So because of that possibility, let's try to make a therapy in which we'll actually plant an antibody in a patient which can fight with the virus itself, and hence called as passive immunization. So what exactly is this convalescent plasma? Few questions need to be answered. Number one, by definition, it's a type of passive immunization where preformed antibodies against an infections are infused to a susceptible host. And the reason of that being to prevent an infection. So what you must understand is, it is basically a type of passive immunization. And what is passive immunization? It is a way of giving antibodies. So when you give antibodies to a patient, it is called as passive immunity. Okay. That is what is written here, a preformed antibodies. Now, preformed antibodies not in the patient, we are giving it from the donor's person to the recipient person. Okay. Secondly, various other things we should all understand. Number one, how to get a convalescent plasma. Okay, well, how to get a convalescent plasma. So that means the few things you should understand. The basic process and how does it. Look, this person I've drawn in green color, he is the donor, okay, and this red person here, let's assume I have just cut his head here, but he is the recipient. Okay, so what we do is, in a person who was already infected with the COVID-19 infection, he is the donor now. So we take this person's plasma. And how do we take plasma? Because when you take out anything you take out from the veins, what comes out is whole blood. So basically what you do, you need to separate out the plasma from the whole blood, and that is called as plasmapheresis. So what you do, you separate only the plasma from the patient's body. You do not take out the entire whole blood. You just take out the plasma from the patient, and that plasma is then prepared, and this plasma is then given to the recipient who is now currently infected with COVID-19 infection. To explain this in a more detail, I need to show you some more important details. Like, now this is the machine. Okay, what does this machine do is, this machine is called as apheresis or a plasmapheresis machine. Apheresis is a process in which you actually try to remove something, and that machine is mostly used to separate out the platelets in a person. Okay, platelets in a person. But when you talk about the plasmapheresis, this plasmapheresis is a machine in which the plasma is separated out from the donor's whole blood. To explain that in a more detail, look at this concept. What happens is, okay, before I show you this, let me show you the how does this machine exactly works out. Okay, look at this. There you go. So what happens here is, this is the machine. Okay, this is the machine, and in this machine, there you go. What does the machine does is, if you have seen that, what happens is, sorry, let me show this machine, this whole thing again. There you go. So what we do, we first of all add anticoagulant here. Okay, we add an anticoagulant. The basic reason of adding an anticoagulant to the whole blood is, unless you don't add an anticoagulant, the blood that you've taken out will clot. So you have to add a citrate-based anticoagulant to the patient. Now this is the machine. This circuit is quite complicated. You don't need to know the details of this. But what this machine does is, the machine takes in the blood, and then the machine has an inbuilt centrifuge to it. As you see above, the centrifuge is spinning out. Now if you look at this, this is a centrifuge, and this rotates at a very high speed. So when this rotates at a very high speed, just imagine that this is a test tube. Okay. Now this test tube here, this test tube has a whole blood here. Okay. Now if you spin this test tube like this, so what happens, as you all know, RBC will come to the lower side. Above that there would be buffy coat, and above that there will be plasma. So what is done is, so when you basically this machine is rotating. So when the machine is rotating at high speed, let's assume this is a there's a test tube, and in which there's a whole blood. Now when you centrifuge this like this, what will happen is, the RBC, because it has very high density, will come to the lower part. Then there will be WBC, and above that there will be plasma. Okay, so the same concept is being used here also. So what happens, when the machine spins off, now see, the plasma is separating out, and the platelet is separating out, and there is a red cell also separating out. So three components are getting separated out inside the machine, while it is centrifugating at the real time when the blood is coming out of the person. Three components. What component? Plasma, platelets, and the RBC. Let's move forward. So what happens now? First of all, as you just saw there, what comes out first of all is plasma. Okay. Then what comes is a platelet, and finally what comes out is RBC. Now as the plasma is coming out, what we do is, this plasma is taken out in a separate bag. The platelets and the RBCs, along with these platelets and the RBCs, they are the ones which is then to be returned back to the patient. They are the ones to be returned back to the patient. But now you will be asking me, sir, what happens to the WBC? The WBC, what happens to WBC is, this WBC is absorbed by an absorbent. Because you all know, WBC are the ones which will release some cytokines, and cytokines can cause issues in a patient. So this is what this whole thing is. Let's come back to our own theory. So what we're doing is the whole blood is going from here, and then this machine is centrifugating from here. So three things are separating out. There is red blood cell at the outer side. Then there is white blood cells. So red blood cell, suppose the centrifugating is here. So RBCs most outside, then WBC, and then there is a plasma. Now this plasma has to be taken out. This plasma has to be taken out, and there is a bag created here, like this is the bag here. All the plasma is then taken and is actually started to be collected in a bag. It is called as plasmapheresis. So basically what happens that the plasma is only separated out while the RBCs, the platelets are given back to the patient. At the same time, there are some good machines which can actually also absorb the WBC out of it. So once the WBC is absorbed out of it, what will happen is the WBC will neither be in the plasma and will go back to the patient. So a slight amount of WBC not going back to the patient will not cause an issue. But now you may ask me, sir, what are the benefits of a convalescent plasma? So why are we not giving a whole blood? You see, do you know how much amount of blood can you take from a person? The maximum amount of blood that you can take out from a donor is around 450 ml, but that is a whole blood. Suppose you have this machine I was showing you. Suppose in this machine, you have an advantage that you're only taking out plasma while returning the other components back to the person. So while you are able to take 450 ml of whole blood, you can now take 450 ml of plasma from the patient. So the amount of plasma you can take out from that person is quite more compared to taking out a whole blood and then separating out plasma from here. Okay? So ultimately, the amount of plasma you get from a whole blood separation is only 150 ml or maybe 100 ml. But the amount of plasma you get from this Plasmapheresis machine is around 450 ml, which makes one complete collection. Now this complete collection is then kept in two doses, 200 or 250 ml of each, which makes a 2 units of plasma which is actually collected from a single donor patient. Okay. Now, some other things you should understand, like, sir, is the benefit of convalescent plasma, only this giving of antibodies? No. See, what happens is when we are giving a plasma to a patient, not only the plasma, but that plasma will have complements, will have some antibodies, will have some proteins, will have some antibacterial enzymes like the lysozyme. So these all are the other benefits that is given to the recipient along with the antibodies. Okay? So it is not only the antibodies, there are some clotting factors. There are some anti-inflammatory cytokines, because you understand that cytokines are the major problem that actually happens in a patient who is actually suffering from COVID-19. And a person who has actually recovered from COVID-19, he has anti-inflammatory cytokines. Okay. Second, opsonization. That means the complements will lead to opsonization. There is a direct neutralization by the antibodies, definitely antibodies. Along with that, there is also a clotting factors along with other proteins and enzymes, which is actually going to the recipient person. Now, the second question, other question that comes to our mind is why the convalescent plasma is preferred over whole blood transfusion. I think I've given you two big reasons. Number one, the amount that is actually taken out is quite less, so it has minimal impact on the donor's hemoglobin. Number one. Okay? Second, a larger volume of plasma collection is done per setting, and you will be surprised to know that actually up to 15 ml of 15% of whole blood can be taken at a time, which makes up to 450 ml of plasma rather than the whole blood. Okay. And finally, you might also be knowing in this way, a single donor can donate plasma every 7 days. Yes, you heard it correct. After every 7 days, a person who was infected can donate a plasma to the person. So after every 7 days, he can donate it. The reason being, you are taking just a small amount of plasma, that is only 450 ml. And this amount of plasma can be again rebuilt in the donor person, not in maximum in a time of 7 days or 3-4 days. Okay, so again, is fit for donation after a period of 7 days. Who can donate a convalescent plasma? So ICMR guidelines have made some basic rules, and the basic rules are: number one, any man or a woman who has not been pregnant. This is one thing. So why not pregnant? Because pregnancy actually causes alloimmunization of the HLA antigens. So it is not preferred. Okay. Age between 18 to 65 years of age. a body weight of more than 50 years of age, and in a past he was a COVID-19 infected person. So while he was a COVID-19 infected person, remember one thing, it has been very clear told by the ICMR guidelines that the RT-PCR negativity is not required before a person is eligible to donate a plasma. So how will you determine whether the person has actually recovered it from the COVID-19 or not? The basic thing is to look for his antibody levels. Okay? So if the donor's antibody level is quite high, so the three ways you can measure it. Number one, you can look for the neutralizing antibodies, but this is a very cumbersome technique and is not very readily available in most of the centers. So even though this neutralizing antibody is not very commonly done, but if you look at the titers, it is believed to be more than 1:640. Now this titer is not very easy to achieve even in a recovered person. So this is a major hurdle when you look at the antibody levels. Second is an adsorbent unit by a machine called as the chemiluminescence assay, and that looks at around a value of 13. Okay? Or a specific IgG antibody or a neutralizing antibody you can also look for. But if you ask me, sir, in India, what do you look for? In India, we look for this value because the specific titer value is not available in our country. So in our country, we basically look at the adsorbance unit, which is got from a CLIA machine, and the value is around 13 or more than 13. So now some question is often asked, sir, does it require a ABO compatibility? Yes. All the proper procedures which is actually required for any whole blood donation is also taken for a plasmapheresis also. That means you have to look for the cross compatibility, minor mismatch, major mismatch. You have to look for the ABO compatibility. You have to look for the RH group, and you also have to look for the infections, mainly HIV, HPV, HCV, malaria, and the syphilis. All these tests are done just like in a routine whole blood transfusion or a PRBC transfusion. Next. Now coming to the concept, what made people to believe that this would be actually beneficial to the person? Now, if you look at this timeline graph is showing you this is the area where the symptom gets onset. Okay, so let's make a line here. So as you see, when the symptoms gets onset, the infectivity is at the peak. Maximum infectivity is there. Now what you're seeing is in 10 to 14 days, the symptoms are always there. You always know this fact. Okay, when a person is infected, he goes for isolation for around 14 days. Now, after 14 days, the symptom resolution starts. After 14 days, the symptoms resolution starts. Okay. Now, what happens is, now what happens here is, after this symptom resolution, and after 2 weeks of this, please understand, after 2 weeks of symptom resolution, this is the ideal period for plasma donation. That means, now if I make it very simple for you, what you must remember is a person's symptom resolution is occurring on this day, and after 14 days of symptom resolution, after 14 days of symptom free, he is fit to donate a plasma. Okay? And as I told you, every 7 days later on, he can donate a plasma. Every 7 days later on, he can donate a plasma. So this is a very, very good thing that you must be able to explain to your patients, or you must be able to explain it to the general public. Okay, so he can donate plasma after every 7 days, and if he asks you when he can donate it, after 14 days of symptom resolution. I told you RT-PCR negativity is not a requirement for donation of a plasma. Okay, now coming to the antibody levels. You see, just as when the symptom got onset, after 5 days, the IgM is rising. The IgM is rising just after 5 days. But you all know, IgM will always wane off. It will come down. So what we are looking for in that person is IgG response. It is seen by the various studies. I've read the studies which tells us that the amount of time that is IgG will be actually positive is around that the amount of time will be around 3 to 4 months to 2 to 3 years. But as you understand that those years have not passed as of yet, so the studies are not very compelling, which can actually tell us that what is the amount of time at which this IgG will be still positive. So this is not very clear in our minds. Anyhow, so what we look into the convalescent plasma is the amount of IgG antibodies. Okay, the amount of IgG antibodies. So few things I told you here. Number one, when to donate? 14 days after being symptom free. RT-PCR negativity not required. the amount of adsorbance unit should be more than equal to 13. But if you look at a tighter level, which is not very readily available, it is 1:640 and above. 1:640 and above. Now the second question is, sir, who can be given a convalescent plasma therapy? Who are those people who can get it? Four basic requirements are there. Number one, in early stage. Second, in 3 to 7 days of symptom onset. There should not be an antibody against the COVID-19 in the person, else this will not be very beneficial. And finally, you should get an informed consent from the potential recipient. To explain these 4 points in a better way, let us understand the basic things here. Well, obviously, we should not forget that unless the treating physician doesn't feel there's a need of this, this is not very much required. The clinical use and what are the dosage? Please understand, with the various studies being done nowadays, the maximum benefit of a convalescent plasma is believed to be in two settings. Number one, moderate to severe, and number two, critically ill patients on life support. The two main indications, please remember the two main indications for a convalescent plasma therapy. Number one, moderate to severe infections of COVID-19. In this, we actually give 2 to 4 units, and 2 to 4 units means, I told you, 1 unit will have 200 to 250 ml of plasma. Okay. So moderate to severe symptoms like patients with organ dysfunction, any organ not working properly, hypoxia, ARDS, acute respiratory distress syndrome, requiring oxygen supplementation, those can be given this plasma. A second is critically ill patients who are actually on ventilators or life on support. But the two other indications which is not exactly indication to be preferred nowadays, particularly when the amount of plasma available for routine use is very less. So those are post-exposure prophylaxis for high-risk contacts. I think this has been now replaced by vaccination, which is now readily available. And second, asymptomatic mild illness. So these are the two other indications, but it is not routinely being done for these. So if you ask me, sir, whom are they maximally beneficial? They are moderate to severe infected patients, and secondly, patients who are on life on support. Okay. Finally, let's move ahead and see what are the side effects of this convalescent plasma. Just like any other donations, the biggest side effect of this is infections. Okay, infection is one of the major side effects which is very difficult to be removed in any cause of plasma donation. Second, allergic reactions. So when you are donating a plasma, the plasma will obviously contain some proteins, and every protein, as you all know, they are actually allergic. So yes, allergic reactions will be always a major side effect of a plasma therapy. Two other things which you must also understand is, when there is a patient who is suffering from a COVID-19 infection, he is slightly, I would say, dehydrated. Okay. So because of dehydration condition going on in this person recipient, when you give this plasma to the person, the amount of plasma going into him can lead to a circulatory overload. The major reason is the heart is not very, adapted to the more amount of blood. So when you give 450 ml of blood, maybe, or 450 ml of plasma in that person, the volume suddenly increases and the heart will or may fail a bit. So the findings of this TACO, as you all know, transfusion associated circulatory overload, may be a hypertension, maybe a tachycardia, and can be high volume cardiac output. Finally, the TRALI. TRALI is basically the reaction of antigen antibody. It is mostly happens because of the HLA isomerization. That means the HLA of the donor person reacting to the anti-HLA antibody of the recipient. Now, this is the main reason. You see, this TRALI was the main reason why the transfusion is not accepted, or the donation is not accepted from a person or a lady who is pregnant, because a pregnant lady is usually exposed to multiple HLA from the developing fetus, and therefore they are not taken from the pregnant women or who has ever been pregnant, right? Now, challenges and limitations of convalescent plasma therapy. What do you think is the challenge? The basic challenges are, when I was talking about this, IgG, IgM, this serological diagnosis, I was talking about a neutralization titer. I was talking about 1:640 titer. There are very less tests, very less, I will say, laboratories or hospitals which actually do a titer antibody levels. Also, the laboratories or the hospitals which do a neutralization antibody is also very less. So the biggest challenge is you don't get the actual titer level, and we have to depend upon the adsorbance value. As I told you, it is more than 13 in some of the machines. It is given as 10, 12 or 13. So 13 or more than 13 is the usual cutoff taken by the Indian Council of Medical Research guidelines. Now, US says the value being more than 1 is to 160. European guideline says 1 is to 340, and Chinese guideline says 1 is to 640 are these basic titers which should be there in a donor person when he can donate a plasma to the recipient. But again repeat, these values are not readily available in the donor. So the basically what we depend upon, again repeat, is the CLIA adsorbance unit, which is more than equal to 30. So the biggest challenge is unavailability of the titers and levels or the neutralizing antibody levels. But the biggest reason for a person not to donate is not the unavailability of these titer levels. The biggest problem of the reluctance of the donor is, number one, when he has to again visit a center, he has that feeling in his mind that I was infected with COVID-19, and if I go back there, who knows, my family members will again be exposed. So let me not visit a donating plasma center yet again. The second problem is, as you understand, nowadays there's a lockdown happening in most of the states. So in the lockdown scenario, the person's mobility decreases. And the final thing is, the people are not actually aware as to whether they will get weak after donating a plasma or not. But if you're listening to this lecture, you can actually tell the person who is able to donate or who wants to donate to be very clear in the fact that he can donate plasma very easily. There's no health issues at all. Even he can donate plasma after every 7 days. The only thing he should have is the feeling, the guts to help other people. Now, we have been talking a lot about this plasma therapy. But in medical science, the biggest thing that we always have to understand is that unless there are not proper guidelines, unless there are not proper evidence, we cannot give a therapy to the patient. So I have found out various articles, general articles, because the textbook doesn't describe them. So I've read various articles and I've tried to find out that what does these articles tell about as to how efficient this convalescent plasma therapy is in a patient. The biggest study was done in a US, and in which recruited around 35,322 patients. And their conclusion, at you in a single line, they concluded, so when the recipients, how was the recipient response? It all depended upon the donor antibody titer level. So when the donor antibody titer level was low, the mortality was 13.7%. Mortality means the death rate. When it was medium, it was 11.6%. And when the donor antibody titer level was high, it was 8.9%. That means, as please understand what I mean by this statement is, with donor's antibody titer level high, it is more beneficial to the recipient. This was the basic idea that they gave in their own studies. One biggest study in our country was a ICMR sponsored Placid study. This Placid study recruited around 462 moderately ill COVID-19 patients, and they did not find, please understand, they did not find any difference in the mortality in the person who were given and who were not given. Now, this was the biggest change that actually came in the study done by the ICMR sponsored Placid trial. Now, what does it mean? It simply means that according to the Indian guidelines, the response that one expected last year was not actually true. And you will also appreciate the same thing being now percolated throughout the media and the physicians, because the charm, the therapy, the sudden slide that everyone saw in the longest tunnel, there was a dim light that yes, this convalescent plasma therapy is now the answer to every drug to COVID-19. But this year, the plasma therapy, even though is being pushed, is not being accepted by many clinicians, and therefore is not being pushed upon, because of the study being done in India, finding no major difference. There was slight amount of difference, but not major difference between people who are given the plasma and the people who are not given plasma. So that is the basic reason that constant plasma therapy, which is thought to be a big breakthrough, was not actually proven to be. So finally, because of all these things, so what and where do we stand for? The Ministry of Health and Family Welfare now has put the cognizant plasma therapy as an off-label experimental therapy. That means this plasma therapy you would not be um, seeing as a essential therapy for COVID-19. So if you conclude the entire discussion that we had, a few things should be understood. Number one, the use of the constant plasma therapy, number one, is majorly restricted to the moderately to severely ill patients. Second, on those severely ill patients who are on life support or ventilator support, their use on very mild ill patients or the use on asymptomatic prophylactic patients have not been very much used for. Second, a person who wants to donate, they should be encouraged to donate enough, and they should be encouraged to donate after 14 days of their recovery from the COVID-19 infection. This therapy is actually labeled as an off-label experimental therapy because we are just experimenting. We don't know the exact nature of its outcome and hence being called as off-label experimental therapy by the patients. Fourthly, if any person wants to ask you, how will I get to know that I can donate a plasma or not? Ask him to get its antibody level titer. If the titer level is more than 320, in most of the India scenarios, it is quite acceptable. But if you look at the guidelines, it is more than 640. But if this titer level is not available, you will ask him to do a CLAD test of the IgG antibody. And if the values are more than 13, he should be encouraged enough to donate the plasma. Plasma therapy as of now is being used in most other centers and has been shown to be quite a good response. However, the studies are still remaining to prove how benefit there would be in the COVID-19 infection. So yes, have we found that unique cure to the COVID-19 infection? I don't think so. Have we found a way out? Yes, we have. So let's try to donate, let's try to encourage people who want to donate, and let's see how the effect occurs on the patients who is actually trying to donate this entire thing. Finally, final words: keep safe, be protected. I think that's the best way to come out of the infection, not to get infected on the first instance. Secondly, if someone has an infection, ask him not to at all worry. Home isolation and a home care will treat 90-95% of the people who are suffering from COVID-19 infection. Only 5 to 10% who are actually having some comorbidities like the hypertension or blood pressure or obesity, diabetes. They're basically people who would require hospitalization. Anyhow, the constant plasma therapy is one of a breakthrough, and that breakthrough should be utilized, and more studies need to be done before we prove that what exactly the effect is on the patient. That is all from my side. I hope you like the lecture. Do let me know if you have any doubts. I can clear it here itself, and we can have a healthy discussion out of it. And let me know that what else you want to understand from me, and maybe I can give you that, and I can teach you that, maybe I can discuss with you that in a better and more experienced manner. Thank you. So I'm just waiting for your doubts that any comments that you have. I can just wind up that now, right now. Okay. Yes, there's a basic obviously need for centrifugation to separate out the plasma. That's a basic need required, because unless you don't centrifuge the whole blood, the plasma will not come out. As I explained to you, the density gradient of these are very different, and therefore because of different density gradient, first of all, what comes out is the RBC on the right side. So what is separated out from here is the plasma. Yes. Sir, thank you, Anirban, for your wonderful comment. A video on remdesivir would be very beneficial. I would try to bring that also, right? Um, Spandana asking, sir, is there any time interval for recipient to receive plasma? Like within how many days of infection? Yes, it is believed that this plasma therapy is more beneficial if when it is given after 7 days, or sorry, after 3 days of the infection. So the best time to receive plasma is between 3 days to 7 days, because after 7 days, his own IgG antibody starts developing, and then the IgG antibody of the recipient starts interfering with the donor's IgG antibody. Sir, if the RBC have been separated, why ABO blood grouping is required? So, Khushi, what happens is whenever you are trying to separate out the RBCs, you'll always expect a small amount of leakage of those RBCs into the plasma. So, even a few RBCs in the plasma can cause a huge Hawaii event in already ill patient who is suffering from COVID-19 infection. So the basic idea to look for this ABO compatibility is to be sure that the plasma you're giving to the recipient is completely safe.